It's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is our weekly COVID and wellness update. So today I'm going to be talking to you about the current disease burden across the state of COVID-19, as well as vaccine issues, masking issues. And then I'd like to finish up by giving you some concrete steps and tips for helping to manage your employees' emotional and mental health and well-being. We know that folks are incredibly stressed, even though we're beginning to see the light at the end of the tunnel with COVID. So let me jump right in and share with you the data um, that I'm looking at, and that is our disease burden across the state. So when you go to the South Carolina DHEC page, you can click here. And you're going to see that we, for the most part, are in the low disease burden category. We still got a handful of counties that are in the moderate disease burden category. And this is very, very encouraging. However, as you've likely heard, across the nation and of course across our state, the case load is going up. So for example, 6 weeks ago, our percent positive rate, which is sort of a proxy for the disease burden, was 2%, which is fantastic. About 4 weeks ago, it climbed a little to 3%. And in the last 2 weeks, it's climbed to 4.4%. Now, this is still below that 5% benchmark that we wanted to maintain, but we know that cases are on the rise. Unfortunately, the majority of these infections are occurring in our unvaccinated population. And all deaths and most of our severe infections, our ICU patients who have COVID, are also in that unvaccinated population. There are breakthrough infections, folks who get the COVID-19 infection even having been vaccinated, but those infections tend to be very, very mild. The increase in the rate of the Delta variant infections is also concerning because we know that the Delta variant is very easily transmissible. So among our unvaccinated population, that Delta variant can travel very, very quickly. And again, that's the population where we're seeing the more severe cases, the ICU cases, and all of the deaths. Now, the good news is that the vaccine does seem to be protective against the Delta variant, especially Pfizer and likely Moderna. So, vaccination is the answer to preventing infection and preventing spread and bringing an end to this pandemic. Unfortunately, if you go to our vaccine dashboard here on the South Carolina DHEC page, you're going to see just under 44% of our population is fully vaccinated and protected from COVID-19, including that Delta variant. That means the majority of our population is not. That 54% is very susceptible to this Delta variant and other forms of the COVID-19 virus. So there have been a lot of studies look over the last year looking at who is getting vaccinated, who is thinking about getting vaccinated, and who absolutely is not going to get vaccinated. And of course, we're focused on those folks who are in that wait and see group. What is it that's keeping them from getting the vaccine, and how can we answer their questions so that they feel comfortable getting this very effective vaccine and avoid the COVID-19 infection. So here's some of the data that has come out of that research. In that wait and see group, it's really left in that wait and see group, it's really three main groups, and that's our young people, 18 to 29-year-olds, African American adult men, and the uninsured. And that's likely a proxy for something else, possibly health literacy, poverty levels, maybe access, that sort of thing. But unfortunately, the folks, at least in the last two groups, African Americans and uninsured, are at higher risk for getting the disease, but also for the complications and consequences of getting COVID. And so, of course, we would want folks in these populations to be vaccinated. So when they dig down to find out why, and they ask these folks why they're in that wait and see group, Many of them say, well, I don't need it, I'm healthy. We'll talk about why that's not a great reason not to get the vaccine in just a minute. Others say that they don't trust that the vaccine, because the vaccines only have emergency use authorization at this point, and that once the FDA has approved them fully, that they'll consider it more strongly. And then finally, there's some folks who are concerned about this myocarditis or inflammation of the heart, especially in men, that's been in the lay press after getting the vaccine. So let's talk about that for just a second so that you have the information you need in case you're asked about this. That myocarditis occurs in a very, very, very small percentage of folks. It's about 16 people per 1 million people who've been vaccinated. The other thing that's important is that myocarditis tends to be very mild, tends to be very temporary, and is incredibly treatable. Now, there are folks who are at high risk for cardiac disease who may be more concerned, reasonably, but for the most part, this is a very rare treatable consequence of the vaccine. So there also has been research around what is going to make a difference for the folks who are in the wait and see group. What information could be helpful in getting them to move from waiting and seeing to going ahead and getting their vaccine? And what they found is that no amount of incentives, not even the pressure regarding mandates or requirements, is really what factors into their decision making. There are two elements that seem to be most successful, and that is engagement with a primary care provider and just persistent messaging. So, in terms of engaging with a primary care provider, what they have found is that when someone goes to their primary caregiver, has their questions, their personal questions, answered and addressed, they are more likely to get the vaccine. So, what we're recommending to employers is to do what you can to incentivize folks to go see their primary care provider. And if they don't have one, to do what it takes to get them hooked up with a primary care provider. And of course, that's a service that we can help you with as well. So whether that's a monetary incentive or PTO to go see a primary care provider or some other way for them to engage with a caregiver, that tends to be the most effective way to move someone from a hesitant vaccine status to getting the vaccine. And of course, someone going to see their primary care provider will bring many, many other benefits as well. The other element that seems to be useful, but means that we all have to be a little more patient, is persistent messaging. In other words, in organizations that continue to loudly proclaim, hey, let's talk about this vaccine. Let's encourage you to get it. Let's answer your questions and find out what's making you hesitant. Do better. And so really that's tincture of time with that persistent messaging along with it. And in some cases, that means it's given folks time to see family and friends get the vaccine and feel more comfortable with it. Others are waiting for that FDA approval. Some I've heard are waiting for fall because that tends to be the respiratory disease season and that makes sense to them. So we just need to continually remind them that this vaccine is effective, it's safe, and it's available. And we can help you with that as well. In fact, I have had numerous one-on-ones with leadership or group virtual and in-person meetings with employees to talk about what this vaccine is and answer their questions to help them feel more comfortable about that. There was some data that was looking and some studies looking at whether the perk of not having to mask if you're vaccinated drove vaccination rates. And unfortunately, this preliminary data has shown that that is not necessarily an incentive to get vaccinated. And the feeling by the authors was that it's because it's so easy to not mask now. Because we are not asking people to prove that they're vaccinated, and we don't know who's unvaccinated. Most unvaccinated folks, if they want to, can stop wearing masks and not necessarily, be required to wear one. In your own organizations, if you have lifted masking and not monitored who's unvaccinated, that means that your unvaccinated employees are at a much higher risk of getting COVID, and that your employee group is at a much higher risk of having an outbreak. And for you, that's not going to work out well if you have folks who have to miss work, and especially if you have large numbers of folks who have to miss work. So I implore you to examine your masking policies, so that you do give the opportunity to folks who have been vaccinated to not mask, but that you are aware of who is not vaccinated, and that they need to be wearing masks to mitigate any disease outbreaks that you may have among your employee base. Again, when we're talking to folks about why it's important to get the vaccine, we're sort of past the obvious things, right? We know that it prevents infection, and that doesn't seem to be speaking to people. We know that the more folks who get the vaccine, the less likely we are to see an increase in disease burden, and therefore the less likely we are to have to go back to those mitigating strategies that none of us liked: social distancing, everyone masking, working from home, no gatherings, that kind of thing. And we also know that the lower the spread, the less opportunity we give this virus to jump from person to person, the less opportunity we give it to mutate further. And the concern is that if we still have a large population that's able to pass this virus around, there is theoretically the opportunity for that virus to develop a mutation that the vaccine doesn't combat, that the vaccine's not effective against. So we're trying to mitigate that spread as well. One last thing I want to mention that you may use in talking with folks, especially our young people who say, well, I'm healthy and COVID's not really going to impact me. And to an extent, they're correct, because most healthy people, if they do get COVID, feel pretty crummy, but do well. Unfortunately, there's two things to consider. And one is that we can't predict yet who won't do well. And so, by the same token that folks say, well, maybe I'm going to be one of those 16 people who gets myocarditis if I get the vaccine. Well, maybe you're also going to be one of the people, the young people, who ends up in the ICU with the disease. And so we have to understand that young folks still can get incredibly sick. But the second issue to consider is long haul COVID. And what they're finding now is that prolonged symptoms, even up to 9 months or a year of COVID, are occurring in 1 in every 3 people who gets COVID. So that's a large number of folks who are suffering well past resolution of the infection. And some of these symptoms are no joke. We're talking about the shortness of breath that impacts daily life. We're talking about what people are calling brain fog, and they're just not able to concentrate at work or in their personal lives, and it's impacting that. We're talking about folks with neurological and psychiatric consequences. We're talking about chronic fatigue for months and months and months at a time. So, real true impact on daily life and quality of life. And that vaccine will prevent that infection and, of course, prevent long haul COVID. And what we've even seen in some data is that folks who have COVID, who had COVID, excuse me, and have long haul COVID get the vaccine, and their long haul COVID symptoms resolve. So many more wonderful reasons to give the vaccine other than just, well, it could prevent infection. It's the right thing for us to do civically. It's a public health issue. But also this could help bring an end to this pandemic, and that's what we're all ultimately going for. So let's go back to masking for just a second. Again, I encourage you to be sure that if you have folks who are not masking, that you are relatively certain that they have been vaccinated. Also, folks who've been vaccinated do not have to quarantine if they've been exposed to COVID-19. Another fabulous benefit of getting the vaccine, especially for you as an employer, if you have an employee who's been exposed. However, unvaccinated employees should be wearing masks. They should be social distancing. And if they have been exposed to COVID-19, symptomatic or not, they need to quarantine either for 14 days, for 10 days, or for 7 days with a negative COVID test on day 5. So many, many reasons why we should encourage our folks to get vaccinated. There's a little bit of information in there for you on how you may approach that by getting people involved with their primary care physician, and then consistent messaging around how important this is as a public health measure. Let's move on to our wellness topic of the day. And sadly, even though life is returning to a little bit more of a normal or at least predictable kind of state concerning COVID, we are not seeing stress levels drop. This has been an incredibly difficult year and a half. People are still concerned with what may happen going forward. They still have health concerns. They still have financial concerns. They may have had traumatic experiences that are haunting them. So there's still a huge emphasis, and always will be, on your employees' emotional and mental well-being. So last update, we talked about ways to mitigate that transition as we move from crisis mode into this sort of maintenance mode. Now we're going to talk about concrete strategies for addressing emotional well-being amongst your employees and your leadership. First of all, if you have an EAP program, hopefully you have engaged with them and you have them at the forefront of all of your messaging. EAP programs are, in general, really rising to the occasion and not just offering one-on-one counseling for folks who are in crisis, but addressing folks at all sort of levels of coping skills and stress management skills in all kinds of different ways, one-on-one, group, autonomously through apps. Engage with your EAP program and find out what they have to offer, and make really, really concerted efforts to get your employees to understand that this is not just for folks in crisis. Try as best you can to remove that stigma and to do what you can to promote psychological safety among your workforce so that they will dip in and out of that programming without feeling like that means something is wrong. If you do not have an EAP program, Prisma Health has a wonderful EAP program, and we partner with LifeWorks and would love to share that information with you and those resources with you if you're interested. So please reach out. There are ways to do your own support groups or own lifting up events within your organization. So consider having leaders give teams time to sit down and just share their stressful experiences. There is a lot of therapeutic value in venting that and sharing those events and parts of life that are very, very stressful. And there's a camaraderie that's built there because everyone has stress in their life. You may plan events that help employees to blow off steam, even if they're for 15 minutes. Games, challenges, healthy competitions, those kinds of things that will introduce levity into the situation and give people a little bit of relief for a while. There's a lot of research around what's called rejuvenation rooms or serenity spaces. I call these quiet spaces, where people can go by themselves and take 5 to 10 minutes just to be still, maybe even take a nap, which, by the way, for you leaders in businesses, makes your employees 80% more productive after they've taken a nap than employees who haven't taken a nap. But a space where folks can just calm down. And that the data behind that in terms of productivity and engagement and even physical health is really, really strong. And then finally, we can help you. We would love to provide you with resources, workshops. I do resilience workshops. I'm going to share with you a resilience tool in just a moment. But we would love to be there for you to help you manage your emotional wellness programming and to brainstorm with you on what might work best. I'm going to share with you one tip that you can take away. This is part of a workshop that I do, and I would love for you to share this with every single one of your leaders and every single one of your employees, or engage me to work on this exercise with groups in your organization. And essentially what we do here is review the 8 wellness dimensions that contribute to our overall well-being. And we get folks to take a look, either individuals or groups, to take a look and put a check by the ones where they feel that they're tending to that area of wellness in their life, and then identify the areas where they are not tending to their wellness in their lives. And then we talk about baby steps so that they can get a check in the boxes where maybe they didn't have one before. And what's so amazing about this exercise is that this is a very concrete way of people organizing their thoughts around a plan. Often when we talk about getting healthy, getting well, addressing our well-being, we really don't know where to start. And this is a fantastic way, as we talk through this exercise, to figure that out. Where do we start? And it's also something you can do over and over again, quarterly, twice a year, yearly, just to make sure you're on track. Because as we know, things change. So I'm going to stop sharing for just a moment and finish up with just wanting to let you know that Business Health Solutions is here to support you. Please reach out to us on our Creating a Safer Workplace page at Prisma Health. There is a phone number there you can call. These videos are archived there as well. Please point your employees towards them. They can all watch these videos and get the same information you've gotten. But we can email, we can have a telephone conversation, we can meet one-on-one and talk about what your needs are and how we might be able to help meet them. There's also a business health newsletter that's being distributed to the organization's leadership. If you would like to be a part of that, we'll make sure you get on that email group. And of course, there's always Prisma Health's blog called Flourish, which gives lots of wonderful information, not just about COVID, but other health and wellness topics that you can share with your employees. We've gotten some requests recently for cancer screenings, and we do have our mobile mammography unit that we can help set up at your site if that's something that you'd like to do for your employees. We have several different WELLS programs, from tobacco cessation to healthy weight management to emotional well-being and stress management, called MindWell. And then finally, we can also provide screenings for you if that's something that you'd like, as well as on-site nurse practitioner care. So lots of services you can take advantage of. Please share these videos and know that Business Health Solutions is here to care for you so you can care for your employees. And I'll see you next month.